Hypothyroidism is one of the diseases that if a person suffers from it, he experiences severe conditions. But fortunately this disease is well known today. As a result, you can easily learn about the cause of hypothyroidism, the symptoms of hypothyroidism, and the treatment of hypothyroidism, and if you have the disease or know someone who is struggling with it, you can help him or her get back to normal faster. So stay tuned for the rest of this video to get a quick overview of everything you need to know, from hypothyroidism testing to the treatment of hypothyroidism in traditional medicine. Before watching the video, like the video, press a subscribe button and turn on the bell so that as soon as a new video is released, you will be the first to visit the video. Cause of hypothyroidism. Hypothyroidism can have different causes. It may also be mild in some males and have no symptoms, or it may be severely annoying to others. Here are some common causes of hypothyroidism. Inflammation of the thyroid gland. Inflammation of the thyroid gland is the result of an attack by the immune system on the thyroid gland, a type of autoimmune disease called Hashimoto's. In this case, the thyroid gland is unable to produce enough hormone. Thyroid disease is more common in women than men. Postpartum thyroiditis. About 5 to 11% of women may develop thyroiditis after childbirth, resulting in hypothyroidism. This condition occurs shortly after delivery and is often temporary. Hypothyroidism after treatment for hyperthyroidism. After treatment of the thyroid with radioactive iodine or surgery, a person may be prone to hypothyroidism due to loss as part of the thyroid gland and often occurs months to years after treatment. Iodine deficiency. The thyroid gland needs iodine to function properly. Many people have low levels of iodine in their daily diet, which makes them more prone to hypothyroidism. Iodized salts can solve this problem. Types of hypothyroidism. As mentioned, the cause of hypothyroidism is varied, and as a result of these causes, it is classified into different types. For example, it can be divided into mild hypothyroidism and severe hypothyroidism. Symptoms, severity, and response to treatment for hypothyroidism in pregnancy, hypothyroidism in children, and hypothyroidism in infants can also vary. For this reason, hypothyroidism can be divided into different types based on its severity and cause. Symptoms of hypothyroidism. Hypothyroidism has different symptoms and can vary depending on the severity of the disease and the individual's condition. Some people may have one or more symptoms of hypothyroidism but do not have hypothyroidism. Conversely, an asymptomatic person may have an underactive thyroid. Symptoms of hypothyroidism occur due to a decrease in the body's metabolism. Symptoms of an underactive thyroid include slow motion, loss of appetite, feeling of weakness and fatigue, dry skin, intolerance to colds, muscle cramps, lack of memory, lack of concentration, feeling of sleepiness, heaviness during the day, weight gain, numbness of the hands and feet, face contamination, especially under the eyes. Symptoms of hypothyroidism in women can be any of the above factors, and as we have said, individual to individual, is different. But women can have other symptoms as well. Other symptoms of hypothyroidism in women include severe and irregular menstrual bleeding, as well as milk discharge from the breasts. Another important issue related to hypothyroidism in women is related to the time of pregnancy. Because a person may have hypothyroidism during pregnancy, they should take their medication during pregnancy, and Levothyroxine, a hypothyroid pill, is safe during this time. Usually, one of the factors that causes the doctor to increase the dose of the drug is pregnancy. Due to changes in the amount of medication, if a person experiences hypothyroidism during pregnancy, he should see a doctor at shorter intervals during this period and check the dose of his medication. Treatment of hypothyroidism. Treatment of hypothyroidism depends on the type of hypothyroidism. For example, if hypothyroidism is due to iodine deficiency in the body, it can be compensated by increasing iodine intake in food. In many cases, we need to make up for the lack of thyroid hormone in the body because the thyroid gland is unable to produce it. For this reason, Chemical drugs are prescribed to patients, the most common of which is levothyroxine. This medicine must be prescribed and used in the right amount, because its incorrect use can cause hyperthyroidism or other complications. For this reason, initially, doctors request a hypothyroidism test at regular intervals after starting treatment so that they can get the right dose and rate of improvement. Once this balance is reached, the time for each hypothyroidism test is about once a year. Treatment of hypothyroidism in traditional medicine. Treatment of hypothyroidism with chemical drugs often results in a faster response. But it is interesting to know that the level of thyroid hormones as well as the function of the thyroid gland in our body also depends on the food we consume. For this reason, in traditional medicine, foods are recommended to improve the symptoms and conditions of hypothyroidism. By following a diet, you can help speed up your drug treatment. In some cases, even a hypothyroidism diet may cause the hypothyroidism pill to be stopped by your doctor. Hypothyroidism diet. In this section, we have explained the do's and don'ts of hypothyroidism diet, by following which you can help correct hypothyroidism. What to eat in hypothyroidism diet. Salmon, due to its vitamin D. Brazilian nuts, due to its wide selenium. Beans, lentils, red meat, etc., due to its iron content, especially for women. Iodine, like refined salts. Tyrosine. Fruits such as bananas and avocados, due to their tyrosine content. In summer, due to their copper content. What foods should we not eat in hypothyroidism diet? Soy, inhibits the iodine function of cruciferous vegetables such as broccoli, inhibits the production of thyroid gluten hormones such as wheat and barley, stimulates inflammation and attacks the immune system. Conditions vary from person to person. Coffee. Some medicines. Vitamins and minerals important for the treatment of hypothyroidism. Vitamin C, vitamin E, vitamin B, protein and omega-3 fatty acids. Tip: to not lose salt. Iodine, added at the end of cooking. Rapid weight loss for hypothyroidism. Obesity is one of the symptoms of hypothyroidism that results from a decrease in the body's metabolism. Also, due to hypothyroidism, a person loses mobility and has less physical activity due to a feeling of weakness and fatigue. The methods used to treat hypothyroidism are to eliminate the symptoms of this disease, and therefore in many cases, with the start of treatment, the drug can be effective in rapid weight loss for hypothyroidism. It is also another method that not only increases mobility in the person and helps him to go through the treatment more easily. Exercise also helps in rapid weight loss for hypothyroidism and also in improving its other symptoms. You can choose the best exercise for hypothyroidism by consulting your doctor and also according to your physical strength, and it is better to start with light exercises such as walking and aerobic exercises, as well as exercises such as yoga. People whose hypothyroidism is being treated and who want to maintain their fitness and prevent a return to their previous weight, it is best to eat a moderate diet to not only help them lose weight slowly, but also to help them stay healthy. If you like this style of video, then subscribe and support me with your likes and comments.